Today I want to talk about tailbone pain or coccydynia. So let's start with going over an anatomy review just so you know where exactly we're talking about. So your tailbone is the very bottom of your spine. It's this little triangular piece that attaches to your sacrum. Your pelvic floor goes from your pubic bone to your tailbone from one hip to the other. So if your pelvic floor muscles are tight and pulling your tailbone inwards, that can cause joint stiffness, muscle stiffness, hypomobility, difficulty moving, and that can cause some pain issues. You can also have some nerve type pain when it comes to tailbone issues because you have a very complex nerve plexus called the coccygeal plexus in this area that the tailbone protects and houses. There are other issues that can be contributing to tailbone pain, like constipation, diarrhea, sexual activity, a fall, like if you slipped on the ice and landed on your butt. So it's important to figure out the reason behind your tailbone pain so you can address it correctly. If your tailbone pain is caused from more a musculoskeletal or inflammatory type issue, pelvic floor therapy can definitely be helpful for you. These are the things that I assess when my patient is coming in and complaining of tailbone pain. One of the first things we're going to assess is seated posture. Tailbone pain can very often be, it's not caused by poor posture, but poor posture can contribute to worsening or tailbone pain that's not improving over time. So seated posture in a very slouched, reclined position with a lot of the weight on your glutes versus sitting more upright on your legs. That is called sacral sitting. So basically you would be sitting more like this, and all that pressure from the chair and your body weight are meeting right at your tailbone or your sacrum, and that's causing some irritation to that joint that connects the coccyx to the sacrum, which is called the sacrococcygeal joint. Improving your posture from sacral sitting into a more upright sitting position is always one of the first things that we talk about when dealing with a patient with coccydynia. One of the easiest ways to do that is by getting a lumbar pillow, and this long skinny type pillow is going to be good for forcing your back into a more forward position, which takes the pressure off of your tailbone in the back. It puts more weight equally distributed through the tripod of your two sits bones, your tailbone, and including your legs as well. So that will take some stress off of that sacrococcygeal joint to allow for less irritation and less stiffness over time. This is especially important if you sit long hours or work an office job. My suggestion is to take 5 minutes per hour and do something active. So whether it's walking around, doing a couple squats, doing a couple stretches if you can. And it can be seated stretches as well during that sitting period of time. Something else that you can think of are getting a certain type of cushion to sit on while you're sitting in your desk chair or your office chair or wherever you're sitting. They make specific ones for tailbone pain. Don't get a donut type cushion because the donut actually puts more pressure on the tailbone just because the middle is empty. So you want to get more of a wedge type cushion that has a notch cut out in the back so there's no pressure placed on the tailbone. There are some options from the Cushion Lab, Tush Cush, Kabooti, the purple cushions, the purple gel cushions. There's lots of different options out there for seat cushions, and I'll include a link in the description of this video. Some treatments that I do for patients who have a lot of pain would include modalities like using a TENS unit or dry needling with electric stimulation, or maybe even KT taping to help reduce pain and decrease nerve sensitivity and improve the patient's confidence with movements so we can go and move forward with exercise and more active type therapies. Active type therapies would include stretching and mobility exercises as well as progressing to strengthening and stabilization exercises. I usually start with stretching and mobility because it's less intense for the patient, it's not likely to cause any type of flare-up, and it allows the patient to become more confident in their movements. So when they do progress to more intensive strengthening activities, they aren't afraid that they're going to have a flare-up. So my stretching and mobility exercises to start out with include diaphragmatic breathing in child's pose position or puppy dog position, where you're getting a stretch through the low back and the glutes. Lots of pelvic tilting exercise to become more aware of proprioception and how you're sitting in your chair. So pelvic tilts in a laying down position, sitting position, standing, even in quadruped, which maybe would be similar to a cat-cow. Also, giving rotational exercises is going to be important just to get the whole spine moving better. So thoracic rotation exercises like open books or like a thread the needle, or lower trunk rotation for the lumbar spine. Some general stretches that I give for patients with coccydynia would include happy baby stretch, figure 4 stretch, piriformis stretch, knee to chest, those types of things. One of my favorite exercises for patients with posterior pelvic floor tension or tailbone pain would be using a yoga block with your one knee elevated in a hands and knees position, shifting your weight backwards and forwards. You're going to get into a hands and knees position with one knee elevated on top of the yoga block. When you shift backwards, you are going to breathe in. Think about trying to feel a stretch through that one glute, that one hip, the back of your hip, your pelvic floor, while you're shifting backwards, and shift forward and just breathe out. You can even internally rotate your leg a little bit to get a bit more of a stretch. So bring your foot out while keeping your knee in. Again, breathe in and shift back. Feeling a stretch and an open through the back of your hip. Breathe out and go forwards. After you've done stretching and mobility exercises, it is going to be really important to transition to strengthening and stabilization exercises. And the reason this is important is if your primary pelvic girdle stabilizers, like your glutes, your core, your low back, are not supporting your pelvic girdle as they should, your pelvic floor muscles kick on as a secondary stabilizer. And so then your pelvic floor can become overactive. And remember, if your pelvic floor is tight and overactive, it can pull on your tailbone, creating ongoing tailbone pain problems. So increasing the strength and stability of your primary stabilizers will take some strain off of your secondary pelvic stabilizer muscles. My favorite exercises for this would be starting with something laying down, again, as to improve the patient's confidence with strengthening movements. So starting with clamshells, reverse clamshells, bridges, things like that. And then progressing fairly quickly, if possible, to exercises like sumo squats, Romanian deadlifts, stagger stance Romanian deadlifts, which are my favorite, hip thrusts, progressing to single leg hip thrusts, and then step ups with a glute focused angle versus a quadriceps focused angle. If you are having coccydynia or any literal pain in the ass, hopefully this video helped you understand a little bit more about what's going on and how you can try to move forward and get out of the pain cycle. If you're unsure if your pain is coming from your coccyx or not, it could be time to go see a pelvic health specialist, like a pelvic health physician or a pelvic physical therapist or a pelvic occupational therapist. I will include some links again below on how to find a pelvic floor therapist that could help you with this problem.